Yeah,
Here
recording.
I am in Dr. Rao's secret apothecary at the Paracelsus Institute in Switzerland.
Lustmühle.
Look at all the beautiful stuff. There's a picture of Paracelsus up on the wall. Here are all the... Oh, and here comes Dr. Rao now. Look, here he is at his clinic. Here's Dr. Rao.
Yeah.
Wow, and here we are with Paracelsus and Hahnemann and Dr. Rao.
Yes, yes. For such a film I have to take my white coat.
Here I am at Dr. Rao's clinic and the Paracelsus clinic and about to get my tooth injected with homeopathics after an extraction yesterday.
Yes. Yes, and I will show you the panoramic and why we see out of the panoramic how bad the situation was and that it really was needed to extract this tooth to unfold his real health. It's very theatrical.
It's great. It's great.
We're now moving to the movies. We're moving into the part of this whole medical process is not only to heal me on the outside, like you'd go to the dentist and you just get your tooth pulled, but this tooth happened to be on the meridian of the large intestines. So as we work, we open up the tooth, which opens up my large intestines. My lungs fill with more oxygen and my energy level goes way up. This could save me 10 years of health problems. This is an incredible system. And here we are in Switzerland doing it with the famous Dr. Rao. So Dr. Rao is coming in now.
Yes, and here you see all the ampules which I use for these phenomenal injections. Neurotherapy, Dr. Rao's neurological injections as called neurotherapy. There are the sun remedies here, the Pleo Art A, which is needed. Then we have the Pleopef A, we have the Pleopef remedy, which is needed for the dental injection, and the ubiquinone from Heal. This makes the cell building better. So these three ampules I will take into a syringe and then I will inject them to this patient. So by doing the neurotherapy, the healing will be much better and much stronger and quicker. And there will be no reminding focus on this area. The problem if doctors just extract as there was done before, then there will remain some bacterial infection in the bone because the bone was not post-treated after the extraction. And this is what the patient still has now. And we found another tooth infected and this had to be removed yesterday. And perhaps you tell how easy it went and what we did afterwards.
This is an incredible experience for me. Yesterday, I went into the clinic, into the dental clinic, but before, they injected the tooth with all these amazing formulas, homeopathics, advanced homeopathics. They injected it right in there. I went into sit in the dentist chair. Boom! He pulled it out like it was nothing. Then he re-injected it. Then I was put in this giant magnet. And it balanced my whole energies. And then later, I got an IV. Healed my body. I woke up this morning with full energy. And today, I'm coming back and getting another injection. The healing process is incredible. So soon, they're going to inject right into my tooth. And you'll watch it right into the gum line. As they do that, it opens all the blocked energy, like my meridians move in a certain way, lungs, large intestine, stomach, and sometimes they get blocked from who knows what. I had an old root canal from years ago, and the root canal is a dead tooth in my mouth, infecting and slowing down my healing process. This could age me by years and years and years. By doing this process, I'm going to open the meridians and I will be younger, healthier, stronger. So soon you're going to get to see this process exactly how it's done. This doesn't happen much in the United States, but for those of you who want to stay healthy and young, the Paracelsus Clinic in Switzerland, you can call Dr. Rao, R-A-U, Thomas Rao. Look on the internet, look him up. This is a treatment that could save your life. And if you're one of those people who have an illness, God forbid, but if you should have anything, you come here. This isn't like, boom, we're going to poison you and kill the disease. This is, we're going to lift up, strengthen your immune system, and transform your life so you can stay healthy and strong, in tune with the energy of the heavens, the earth, and man. So soon we're going to start.
Afterwards, we can show here. Come here.
This is so exciting. Susan, go over and get the picture.
Yeah, look this. We have all on the computer. When a patient comes, we take the panoramic X-ray, and when I have the suspicion, because I always examine the patient, when I have a suspicion that there is a dental item in the background for a disease, then normally patients don't know that this has something to do with the dental. But then we take the panoramic X-ray, and look here, I can click. We have all on the computer. We have click here, and so now it comes, takes a little while. Choop, here it comes. Now here we have the picture, and we see the panoramic. It's a 3D tomogram which we have, and we see here the root canal, and this root canal is on a tooth which belongs to the meridian of the large intestine and lung system. And this patient has large intestine problems, but he didn't know that this has any relation to the tooth. And the interesting part is that this man had done by a American dentist, had removed a other tooth here, and it didn't heal. You see, even months and months later, you still see the alveolar. This means the hole where the tooth was in, and you see the whole area around is like wonky. It's like well, it's not a good bone. You see a changed bone. The bone should be like this, and here there is clearly a sign, a radiological sign of a focus in here, in this area. You see the bone is not regular, and that's the important thing. This area is also belonging to the large intestinal meridian. I can show you afterwards the chart, the dental chart, which explains about the correlation between the teeth and the meridians and the organs. And why did this not heal? This is now the interesting part, because here was still a focus on the same meridian functional system. So as long as you have this infection, the meridian is so much disturbed that it could not heal this. Somebody ignorant could say, well, everybody can just say such things. How can you prove this? And of course, Paracelsus, the most experienced and most progressed station, we have a different method which shows us the significance. We have a computerized bone density test method which shows us in the upper right area, it shows us the dental situation, and we see in the lower left area, in this area where the tooth was extracted, we see this red area. This means exactly on the spot where he had the tooth removed, there is still a focus, a bacterial focus, which we can measure with the computerized ultrasound. It's a phenomenal device which makes on each tooth site 512 measurements. On each tooth site it makes 512 computerized measurements. It's like a bone density test, but very fine, very detailed, and analyzes. And now we can see, now we look if this has really a relation to the other tooth, the lower left. Here we see the lower left, I showed it wrongly. The lower left is where the significant, very bad focus is on the lower left molars. And now comes the last, which is the upper right. The upper right, exactly the tooth where he has the root canal, we see an infection. So we have two different methods which have a totally different technology behind. The 3D computer tomogram, a radiographical examination, and this ultrasound bone density measurement, and they show the significance. And they show, and this is the important part, that this area is still infected where the dental extraction was done months and months before, but not post-treated. And that's why we have to post-treat. And he only has a chance to come over his intestinal problems when we remove this tooth also, which we have here. You see, latest technology combined with the knowledge of ancient Chinese medicine, and we use homeopathics and latest automolecular treatments to rebuild the whole area. And afterwards we will show you the magnetic device. Now let's go to action, and I do the dental post-extraction neural therapy. Well, I would say, doesn't this look dramatic? So, okay, now there is the tooth area which was extracted yesterday. See, absolutely no swelling. No swelling at all here, and it was extracted yesterday. And now I do inject into the site a little bit, doesn't hurt. Very slowly this has to be injected. And now a little bit up here. So, okay, to the gum. And then we also do the correlating area which interferes where he had his dental extraction months ago, and it's still not okay. We inject there too, because they correlate with one another. Now swallow. Okay. Good. All done.
How did that feel, Woody?
Well, that was great. I didn't have any pain at all. I don't feel any discomfort. And I know this will open the regulation. One of the things about healing that when
Say
you
that
work,
again. Say that again.
one of the things about healing is knowing that your doctor is confident in what he does. So when you're trusting the doctor and the doctor's using these ancient remedies to open up things, your body heals in a miraculous amount of time. So soon we're going to look at the dental chart when we go outside so you can see the correlation, and maybe we'll get to look later at the machine that actually gave us the idea of what's going on. This is an incredible way to heal your body, mind, and spirit. Until a little later, I'll come back to you and Dr. Rao, and we'll show you some more.
When we extract the tooth on a patient, then first of all we look if it's really needed. We test the significance. We test the significance with these two methods which I just showed you, the Panoramic X-Ray and also the Cavitat, which is the computerized bone density test. And beside this, I also look energetically with a physical examination if the patient really has some problems on this meridian system, which belongs to these teeth. When we decide to take out the tooth, that it is a significant contributor to the disease of the patient or the symptoms, then we do it the following way. The patient goes to our dentist. They are very experienced in doing such extractions. We extract very carefully and painlessly the tooth. It really does not hurt. And afterwards the tooth is getting into the tooth which is extracted, we take to do a inverting treatment, a bioresonance treatment. We invert the vibration, the information of this tooth and put this inverted sickness information to a mixture of drops, of anti-inflammatory drops. And this the patient has to take regularly. Beside this, we do IV infusions, which increase the healing capacity. And the third thing is that we do the magnetic field. This is a very, very strong pulsed magnetic field device which increases the cell membrane load of the cells and makes the healing capacity much stronger. So by doing these three methods, the removing the tooth correctly, re-injecting with Sanum remedies from the Sanum company, that's this phenomenal German company which produces these immune boosting remedies, and the milieu remedies, it's only done by Sanum from Sanum Kehlbeck company in Germany. It's the only worldwide which makes these good remedies. We inject, then magnetic field, then the inversion of the bioresonance inversion of the tooth, and this triple treatment makes that you have no pain and you have really always a good healing. We never have putrefaction and we never use antibiotics after tooth extractions. I have a little story about myself. I like stories, as you know. I had a wisdom tooth which has to be removed. The wisdom tooth, which you know that it can be very difficult. And my wisdom tooth was a focus also. And our dentist always said, you have to remove this wisdom tooth, and